Hello and welcome to the Spirit Vessel Conversation Series, Professionals, Perspectives, and Deathcare. My name is Jessica Wirtz, the founder of Spirit Vessel, and we're so glad you're here with us today. The Professionals, Perspectives, and Deathcare series is centered around conversations with professionals of all types in the death care and emotional wellness space. These conversations aim to help bring awareness, acceptance, and normalization to death and the grieving process. If you enjoyed these conversations, please consider sharing them with your favorite social media platform and be sure to sign up for our newsletter so that you'll be the first to know when a new conversation is released. With me today is my sister and Spirit Vessel co-founder Amanda McClellan, and we are joined by our guest, Penny Hawkins.
Penny Hawkins, better known as Hospice Nurse Penny on social media, began her nursing career at the tender age of 42. She worked in a family practice clinic for 1 year until she was able to get a position in hospice where her passion lies. She holds a bachelor's degree of nursing and is a nationally certified hospice and palliative care registered nurse. Penny's been a hospice nurse for 17 years and has worked in a variety of care settings and roles within hospice, including inpatient, home case management, education, quality, and regulatory. She currently works as a hospice quality manager for an organization in Washington State, operating 3 home hospice locations and an inpatient care center. She is a passionate and quite humorous, might we add, advocate for hospice education and normalizing the end-of-life process to remove the stigma and fear around hospice care, death, and dying. During the pandemic, she found her way to social media and a platform where she can utilize her death care expertise to provide education in a variety of methods that reaches a diverse audience. She currently has over 430,000 followers on Tik Tok and 54,000 on Instagram. Welcome, Penny. Thanks for being here. We're so excited to have you and learn more about your work and just have a great conversation this evening.
Thank you. Thanks for having me.
Yeah. So let's jump into where you started your nursing career at 42. Tell us a little bit about what took you into that career and what's inspired you since then.
Well, I had been a stay-at-home homeschooling mom. I'm married to a military man for 10 years, and the relationship wasn't working out, and we decided to get divorced. And I needed to work. I needed to get a career, and I had only really done bartending and just different kind of fly-by-night jobs my whole life. And so I was looking through the newspaper and thought, nursing looks like something I could do. I had been a vet tech at one point in my life. So I thought nursing looks good. And I had had a previous experience with hospice with my ex-husband's stepmother who got cancer and was on hospice. And I was so impressed with the nurses. They were just really compassionate, and it just really, there's something about it that really struck me. And I had, in my earlier life, before I married my ex-husband, I had been kind of I say ne'er-do-well, got into a lot of trouble, did drugs, went to jail a few times, just couldn't get my life on track. And so I felt like I wanted to go into an area of nursing that was service work. Like I felt like I wanted to do something that was giving back. So at that time, there was also a lot of abuse in nursing homes that was kind of making the news. And so I thought, okay, I'm either going to be a hospice nurse or I'm going to work in a nursing home where I can hopefully make a difference in people's lives. And I was really more drawn to hospice. And then after about a year working in the family practice clinic, there was an opportunity that presented itself. And so I latched on to that, and it's just been where my heart's been the whole time, and I just love it.
That is awesome. You clearly have a passion for it, and that's absolutely comes through on all your content on social media. So you probably get asked a million questions about hospice all the time, but I'm kind of curious, what are some things about hospice that you wish families knew when their loved one was going on hospice? Like, what are some of the most common questions that you get that you wish was just common knowledge for everybody?
Well, for one thing, people think that hospice is really meant for the last days of life. Like it's really about death. It's really about the last days of life. And so we get a lot of late referrals to hospice. And it's even though you have to be dying to be on hospice. We like to say it's about living. It's about the best quality of life you can get for whatever amount of time you have left. We can help people to avoid the hospital. We help them to avoid the ER. We can normalize the death and dying process so that people know what to expect. So the earlier people come onto hospice, the more of our services that they can take advantage of. And we have a lot to offer. So that's probably the number one thing, is get onto hospice as soon as you have that terminal diagnosis of 6 months or less. Of course, other misconceptions are that we hasten death by giving people morphine until they are unresponsive and they die. And that's absolutely not true. We don't give all of our patients morphine. We give morphine to the patients who need it. And we do it in small doses ordered by a physician. They're safe doses. And the goal is to manage a person's, pain or shortness of breath, not to snow them until their death. People do become unresponsive when they're dying. And, so they automatically assume it's the medication that's making them be that way. But that is actually just a part of the dying process, to become unresponsive and slip into that death coma and then die. So that's another misconception that people have. There's so many things, that we like to educate families around. How important it is to have your plans in writing, or at least to have told somebody what you want at the end of life, because it's so stressful for the family to try to figure out what their dying person wants if they've never had that conversation. They don't know. So you have somebody who's speaking for you, and they're naturally, because you're human, if you don't know what somebody wants, you're going to assume they want what you would want. Mm-hmm. And so people are going to do, like what they think is best for them instead of what's best for their person.
Mm-hmm. So you mentioned if people come to hospice early enough that you have many services to offer. And a lot of times when people think of hospice, they think of exactly the first things you said, just those last end of days, keeping someone comfortable. So what are some of the services that you offer to someone if they come to you with enough time after a terminal diagnosis?
Well, one of the most important things that we offer is education around what they can expect as things change, and we can help the caregiver adapt to the changes that their person has. Another common misconception about hospice is that it's a place, and it's not. Hospice is a healthcare provider, and we do the majority of our care in a person's home or wherever they call home, and their family or friends are their caregivers. And so we teach the caregivers how to take care of that person. And as a person is getting close to the end of life, going through the stages of dying, there are many changes that happen along the way, and they need to be educated about how to adapt to those things and help that person. So that's a big part of what we do. And like I said, we help people avoid the hospital, avoid the emergency room, not have to go to doctor visits anymore. Like if you're told you have 6 months left to live, do you really want to have to go sit in a waiting room at a doctor's office if you don't have to? We have hospice aides that can come in and help. And one thing about hospice aides, they do personal care. And so sometimes patients will be resistant to having someone come in and help them with that. And they'll say, no, I'm showering myself, or if it's the spouse taking care of the dying person, no, I'm doing their showering. What they don't realize is that that person is eventually going to get to a point where they have to be bathed in the bed. And so then we're really needing to bring a hospice aide to do that care. And they don't know that person. They've never, you've got a stranger coming in to do personal care. So I was always big on, let's get the hospice aide in here early. If she doesn't do your personal care, she can throw in a load of laundry. She can make you a sandwich. I had one aide that would go every week and put my patient's garbage cans out to the curb for him because he couldn't manage the cans anymore. And little by little, he started to decline. She got to know him. He got to know her. And then when the time came for her to be wiping his butt, it wasn't a stranger doing that care for him. It was somebody that he had learned, gotten to know. Mm-hmm. Social workers help with all kinds of different things. They can help with financial planning. They can help getting those advanced directives in writing. We have chaplains that do spiritual care. We have comfort therapies, massage therapy, aromatherapy, pet therapy, music therapy. We have volunteers that can come in and spend time with the person, do a puzzle with them, play a game of rummy or cribbage, take them shopping. You know, there's so many services that we have to provide to somebody, not just giving them morphine and snowing them until they're dead.
So I actually, Jess and I's grandmother passed away 2 summers ago now, and it was actually a hospice nurse that explained everything to me. Like, I never knew about the death rattle and all of that. And it was a hospice nurse that told me, like, step by step exactly what was going to happen, because she was blessed to pass away at home around family, and they had nursing care there and hospice nurses. And it was just it was a blessing to have them there to walk our family through everything as it happened. So
yeah, well, you know, the thing about the dying process and the death rattle is a great example of that. That is normal. And you talked about normalizing death, and that's, you know, my hashtag, normalize death, because death is normal. You know, if you don't know what to expect and you see your person that you love having these things happening to them, it's freaky. It can really scare you. And if you know that it's normal, it's less scary. And, you know, I so many times I would see a family and they would be in a panic. His feet are turning purple. What's wrong? His feet are turning purple. And I would say, actually, that's normal. You know, the body's shutting down, circulation is changing. It's really normal for the hands and feet to turn purple at the end of life. And they would be like, it's normal. And yeah, it's normal. You know, like the relief was palpable. As soon as you told somebody that what they saw was normal, this is something we've seen before, it's okay. You know, it brings them so much relief to know that. And that death rattle is definitely a great example of something that can really, really upset families, because, you know, people can sound like a washing machine, and the concern is that they're going to drown in those secretions. They're uncomfortable, it's painful, it's harmful, you know, and it's not. And I like to just explain to people, it's really just a noise. It's just a noise, and it's not harmful. They're not aware of it. You know, we have medication that can dry it out. I prefer not to use them because it also dries the mouth out. Repositioning works like a charm, and educating the family that this is normal. They're not going to drown in those secretions. It's just their spit that they're not swallowing anymore, and the air is moving over it, making that noise.
yeah, absolutely. So you guys help the families through so much of this, of the physical side of everything. Is there anything, like, for instance, a lot of families think that as soon as someone passes away, the body's whisked away to the funeral home and they get very little time with the body. And I think a lot of people aren't aware of their options. So I'm just kind of curious what that looks like in terms of your work, educating families or services that you have or anything like that, because that's a big thing that we talk about all the time, and just trying to educate people on their options so that they do have the time with their loved one, you know, before the next step happens.
Yeah, well, you know, they say discharge planning begins at admission. So we do, even when somebody is coming to us with, you know, it looks like a longer prognosis, we do talk about the time of death, what to do. We want our people to be prepared. And part of that is, you know, you will call hospice, you'll call us first. And then, you know, in my state, we don't have to pronounce death. So we'll offer a visit. You know, you can have us come, or you don't have to have us come. And when you're ready, you will tell us, and we will call the funeral home, and they will come and pick your person up. And so we're kind of setting the stage for, there's no rush. Death is not an emergency. I've done some TikToks about this too. Because I'm a quality manager, I review our survey scores. And many times I'll see somebody say that they were upset because they had to wait for the nurse to come, and it took too long for the nurse to get there for the time of death visit. You know, and so I do a lot of education around, it's not an emergency. Death is not an emergency. You know, take your time, be with your person. This is the last time you're going to be with your person in the same room. You know, if they go off to the funeral home and they're embalmed, they're not the same anymore, right? Like, this is the last time you're with your person. So just relax and be with them, you know, and it's okay. Eventually, you know, the nurse will get there and the funeral home will come when you're ready. So definitely setting the stage for honoring, you know, that person being in the home and honoring their time with the person. Like, when you're ready, we will call the funeral home and they will come and get them for you.
Mhm.
Yeah. And what does that look like, Penny, state by state? Because I know that different states have different guidelines that way. But I think that most people just assume, no, it's an emergency, like call right away. This person's last breath just happened, like, you know, the body needs to be removed. What is, can you talk about that a little bit more for us, as far as like state by state
Yeah.
guidelines?
So generally speaking, and just, you know, anecdotally based on my experience with knowing people who work at other hospices in other states, and then my agency also runs hospices in Alaska, California, Washington, Oregon, and Texas. So my agency is very large and we have a lot of hospices. And so we're all the same. Now, the state law around pronouncement of death is going to be different in each state. Like I said, in Washington, we don't have to pronounce. In Oregon, California, they don't have to pronounce. And Alaska, they do. So it's generally all hospices will tell the family, you call us at the time of death and we will take care of everything. It's kind of like the unspoken rule that we are going to manage that for them. It's part of hospice care for us to take care of tying up all those loose ends and helping them get the body where it needs to go at the end of life, and getting them pronounced if that's what needs to happen. So really, that's always the instruction is, you know, call us at the time of death and, you know, we'll do whatever it is, whether it's sending a nurse out to pronounce. But something interesting, and I just did a TikTok about this. I haven't posted it yet, but I was watching, I'm mutuals with somebody on TikTok, a young woman whose mother died and on hospice. And she talked about how the time of death visit, so when she lives in a state where they have to pronounce, her mom died on this date, let's just say the 13th. And it was in the evening, late in the evening, like 10 o'clock at night. Well, the nurse didn't come out until after midnight on the 14th. And so the daughter is a little bit upset because the 13th was a significant date for them. But because the nurse didn't come out until after midnight, the date of death that goes on the death certificate is the 14th. And so she had told me that a while back. And then I was having a conversation with the hospice aide on a Facebook Live, and we were talking about pronouncement. She was asking about pronouncement of death. And I said, you know, in the scheme of things, the date and the time on the death certificate, it doesn't really matter. Like, for whoever's involved, the funeral home, even Medicare, so what? It's one extra day. It's not that big of a deal. But to the family, it can really matter when that pronouncement happens. So in my state, the time of death that goes on the death certificate is the time that the person died. But in these other states, you have people who go, well, the death certificate says the 13th, but really she died on the 12th, you know, because they know that the person's dead. They're just waiting for the official word from the RN to say, yeah, she's dead. You know, it's kind of interesting, you know, a little bit. So I did a little TikTok about that, and how it, you know, if you live in this state where your law says that an RN has to pronounce death, then you might be somebody who wants to advocate for a change in your policy, because it does impact families in negatively, you know, like they want to have that date be the date on the death certificate.
Yeah, yeah. Well, I imagine too, it's just so like highly sensitive, everything at this point. So it's like, you know, to the minute is probably important to some people because they're just in such a stressed out space that it's like these things need to happen just so. I imagine you deal with a lot of different family dynamics. You're probably a sort of counselor and therapist at this point
Oh
of
yeah.
sorts. Or you just like I mean, you're fully involved in every family dynamic so intimately that that you work with in your families.
Oh yeah, definitely. And it's you know, you really have to remind yourself when you walk into a situation that this is just a window in this relationship that's been ongoing for a lifetime. And so a lot of clinicians fall into the trap of, you know, I need to try to fix this situation, and you're not going to be able to fix it. It is what it is. And you have to work within those parameters, because, the daughter has, had this relationship with her mother that's been strained always. And now you can't really expect her to step up to the plate and do the care for the mother, you definitely have to work within those parameters when it comes to those family dynamics. Probably the worst thing though, is when a person doesn't have their wishes in writing. They haven't put anything in writing. In my state, there's this whole hierarchy of who gets to make decisions. So if you're an adult and you're married, it's your spouse. If you're not married and your parents and you have adult children, it's your children. If you don't have children, it's your parents. If your parents are dead, it's your siblings. If you have 5 siblings, it's all 5 siblings, and they have to agree on what to do for you. So that can cause a lot of stress and people arguing literally at the bedside when their person is dying, and they're all arguing about what needs to be done. And it's very challenging. So it is something I educate about a lot is, put your wishes in writing, tell people what you want and put it in writing, and designate a person to speak on your behalf, and make sure that person is going to act on your behalf and do what you want and not what they want.
Yeah, absolutely. So that's really a conversation you walk into each family having. If they don't have that in place already, you're already advocating for it.
Right off the bat in hospice, in my state, we have something called a POLST. It's a portable, they changed the name. It used to be physician order for life-sustaining treatment. Now it's portable orders for life-sustaining treatment. And it's basically, do you want to be a full code or a DNR? Do you want comfort measures? Do you want tube feeding? Do you want antibiotics? It's got all these different choices on there. And it's one of the very first things that we do is try to address that with people. And people sometimes will be like, talk about it, and we just have to keep reapproaching. That's another common misconception about hospice, that you have to be a DNR, or do not resuscitate, to be on hospice. And that's not true. You can actually have a full code status and be on hospice. We don't like it. We don't want to do it, and we're going to revisit it often, but you do have the right to choice when it comes to what you want. If you are going into a medical crisis, and you want to have everything done and go to the hospital, you have the right to do that.
Yeah. Yeah. Well, I have to say this kind of segues into just the fact that you are such an icon on social media with your TikTok and your Instagram in such a great way. You're educating and you're hilarious and you're just as real as can be. And every time I get on, I'm like, she just said that. That's hilarious. She's doing there's just such a realness and rawness to your humor, but it's so, it's just honest. And I just really appreciate what you're bringing and the way you're telling it. So tell us a little bit about your journey on social media, and when, you mentioned during the pandemic you jumped on, but talk about that a little bit, what prompted that?
Okay. First of all, I have to tell you, I laugh whenever I have, in the last couple of weeks, you're the 4th person that has called me an icon, and it cracks me up. I'm like, wow, the first time it happened, I thought, well, that's interesting. And then next thing you know, someone else said it. I was like, what? I mean, I'm not hating it, that's for sure. So I was just like everybody else in lockdown from the pandemic. And at the time, my husband worked nights and I worked days. And I was watching the news and I heard about this doctor, Dr. Nicole Baldwin. She is a pediatrician and she is pro-vax, and she was making TikToks about, you should get vaccines. And she had some anti-vaxxers that sent her some hate mail and death threats, and it made national news. And so I was like, wow, that's interesting. What is this TikTok they speak of? And so I downloaded TikTok, got sucked in immediately by the shuffle dancers. There's these people that do this shuffle dancing, right? And I'm like, that looks fun. Looks like a fun way to exercise. I love to dance. And so I'm trying to learn how to shuffle dance. And meanwhile, I'm seeing all these trends. And I used to be into theater. I sang in a rock band back, in the late 80s, early 90s, and used to do lip sync in the clubs and karaoke. And so I've always been a little bit artistic and silly. And so I did a couple of trends that were just silly trends. And then I'm still watching TikToks, and I start to see people are actually talking about things on TikTok. they're not just doing these shuffle dances and these silly trends. So I thought, I'm going to do like a hospice story. So I told a hospice story and it went viral. And like all of a sudden my follower count shot up. And at that point I had to tell my husband, hey, I'll tell you something, because he had no idea. He doesn't know. He still doesn't watch any of my social media, but disclosed to my employer, I need to tell you about something. I'm on social media and I have an audience and I'm not violating any HIPAA laws, but I just want to be upfront with you about it. And they looked at my site and they're like, yeah, it's fine. And it just grew and grew. I just realized that people really were hungry for this knowledge, and because I believe in adult learning and people learn different ways. And I also wanted to reach a younger audience, because really the TikTok audience mostly is young. There's a lot of us old boomers on there, but mostly it's a younger audience. But I kind of was into like, let me educate the youth. And so how can I best do that? How can I reach the most people? And that is by doing different styles of education. So I do the TikTok trends and the dances and, just straight up answering comments. People like the sarcasm. That's one of the things in my bio. I'm sarcastic AF. And it just kind of grew. So
I love it.
it's
I'm
kind of,
familiar with, sorry, go ahead.
I was going to say it's still the platform is mainly education and normalization of death and dying, but I have kind of branched out a little bit more on TikTok than on Instagram, but into sharing stuff about my life that I think can help to inspire people. And I think that when you're really wanting people to believe you, when you want that believability, when I tell you death is normal and I want you to believe me, it's okay. Death anxiety is normal. You can overcome it. I think that sharing part of your life and sharing your vulnerability helps people to identify with you more and see you as a real person more. And so I've really kind of branched out a little bit in that way.
Yes, 100%. So I'm familiar with this shuffle craze that you talk about. I watched lots of shuffle videos.
I never learned how to do it, but it's so, actually, there was a point when I was like, oh, I'm starting to get this, but I kind of haven't really even seen a shuffle video for the longest time now.
Yes, I get worried about getting on TikTok and going down the rabbit hole, and the next thing you know, an hour's gone by, and you're like, "What just happened? Where did the time go?"
So easy.
But I think it's amazing, and TikTok is absolutely a platform that is growing, especially during the pandemic. I mean, everybody just went online, and we're interested in new things, and like you've mentioned, I think educating people in unique and different ways that might land with them differently than your typical style of education is so important, and anything we can do to normalize the process. So is there anything you do differently on Instagram and TikTok to reach your audience? Because we admire your commitment to educating people and the amount of content that you put out. Like, where do you get your ideas? Do you do anything differently on the two different platforms?
So on TikTok, I would say I push the envelope a little bit more with controversial topics. Definitely was pro-vax, pro-mask during the height of the pandemic, calling out nurses who were anti-vaxxers during the political campaigns, very vocal about where I stand politically. On Instagram, not so much. I still share, parts of my life on Instagram. On Instagram, I kind of share more about my life where I live, which is in a cabin off the grid in the mountains. And so I kind of feature that a little bit more. I do that on TikTok somewhat too, but that's kind of more, I put on my stories on Instagram, that stuff. And I kind of don't do as much of the controversial stuff. I do sometimes. I will make repost something I see about, pro-choice or, gun laws or anything like that I believe in. And I will post something on there. I don't get as much negative feedback on Instagram as I do on TikTok. And and that's probably one of the reasons why I don't post as much of the sarcastic responses. I do some on Instagram, like I'll take them from TikTok and post them on, just to kind of push it a little bit and see how are people going to respond to this. But I don't do as much to get like community guideline violations. I do get community guideline violations on TikTok. So I try to stay away from that on Instagram.
Well, we think it's wonderful, the amount of education that you are doing. So thanks. And we're really curious as well, like your work it's very taxing, I imagine, to be so emotionally involved, so psychologically involved, and just such a caretaker and such a giver in this way. So what are some of the rituals or caretaking, patterns, tactics, whatever you do for yourself day to day, just to take care of yourself? Like, where do you begin with that?
I am not great at self-care, and I don't do direct patient care anymore, but when I did, so every 2 weeks we have an interdisciplinary team meeting, and each team will often do a little memorial thing for the patients who have died. They might have a bowl and they drop a colored stone in it and talk about the patient. And I was never one that really hung around for that. I felt like for me, doing the work is a gift to me to be able to, it's not like I'm gifted. It's like, I feel like I have been given this gift to be able to do this work, to be able to be there and help a person at the end of their journey and help their family. But it is a job. And when I'm done, if the patient has died a peaceful death and the family knew what to expect, then it's a job well done. That is the expected outcome. So never had really, it's not to say I was never sad when a patient died. There was definitely times, mostly around the family, the person goes into this death coma and they're unresponsive. You're still have a relationship with the family for a while. And so oftentimes it's breaking away from the family that's sad. But I'm distracted by my door shutting. Sorry about that. It's like a job well done once the person dies. But there are times when it's a little bit stressful. Even now, I get emotionally involved at times. I do participate in complex case reviews for our patients. So I see these things, and I get messages from people too about their person that's died, especially if somebody that I've been like mutuals with, like Amanda, just some cancer kid. I don't know if you know who she is, 25 years old, died of metastatic breast cancer. And she and I became TikTok friends, and she lives nearby. And I went and saw her and met her in person and got, involved with her. And so that was really sad. But I'm very much into creating. And so for me, my emotional outlet is always around my creativity. And that really is making TikToks. And that is how that's my self-care. That's what I like to do, is to express myself through my TikToks.
Yeah, I love that. That makes a lot of sense. It's different for everyone. So, yeah, I just want to add on to that. Amanda was talking a little bit about our grandmother earlier, who passed away 2 years ago, which was just like really hard for our family. She's just such a matriarch and such a rock. And her partner, Lee, our grandfather, is still alive. He's 98. And he has, I know, he's living at home. And he has a hospice nurse who comes in every day, I believe, at this point. And her name is Amy, and she is just like part of our family. Like, she comes in and she's just like, "Hi, baby doll, how you doing?" We're just like, "Hey, Amy." There's like hugs, she's just like, you'd forget she wasn't part of your family if you didn't know, because that relationship has just evolved to become so beautiful and personal and loving towards our grandfather. So
that is one thing about working in hospice that's different and unique from other areas of healthcare, is that you do really, it's a different type of relationship that you have with families. You have to have professional boundaries, but also you got to give a little sometimes of yourself, because you are dealing with this situation that is oftentimes it's unique. they've never had a person die. It's definitely the first time the person's ever died, right? For the dying person, this is their first experience with dying. And so, we do have to kind of have more of a personable relationship with people. I had a patient one time who was in his early 50s. He lived alone, and he had a type of cancer that caused him to have these tumors that protruded out of his abdomen and leaked stool out of them. So we had to put all these different bags all over his body to contain this cancer. He had been a bodybuilder, like a champion deadlifter. So he had this picture on his wall. He was just gorgeous, buff, huge guy. And when I met him, he was a skeleton with skin on, but still very proud and lived by himself, had a Corvette, that he still bragged about driving 120 miles over the pass. And I'd be like, not while you're on morphine, please. But, I would go to his house and he didn't want to talk about his failing health. He just didn't want to talk about it. He didn't want to talk about the fact that he was going to have to, at some point, either go to a facility or have caregivers come to his home. He just didn't want to go there. And so I would go there and I'd sit down next to him on the couch and I'd open my laptop. And at the time I had chickens and a garden, and he would see these pictures on my screensaver. And so that's what got our conversation going. Like he'd say, how are those chickens doing? And I had to build this trust with him. And he's also the one who needed his garbage cans taken out by my hospice aide. So this guy, he was a full code. He did not want to have, he wanted to have CPR. And he was so frail, I knew that this would just be a disaster. But so anyway, he's failing. He's having more and more pain. I'm seeing him every day. My aide is seeing him every day. I'm talking to his family. They're like, we don't want to try to deal with it. He's a jerk. We don't want to, which the jerks are always the one who are the most endearing, by the way. And I finally convinced him that he needed to go to a care center. Like, you cannot stay home. Your pain is not going to be able to be managed at home. You need to be on an infusion. So got him to go to the care center, and I was seeing him there every day. They got him on an infusion. His pain was better controlled. And I was going to be going on vacation for 4 days. And I knew, with this full code status and with him being very close to the end of life, that there was a good possibility that he was going to go down, and they were going to call the paramedics, and they were going to throw him on the floor, and they were going to do CPR, and it was going to break all his ribs and rupture all his tumors. And so I was leaving the care center, and I stopped, and I was like, I can't leave like this. I just can't do that. So I turned back around in there and I said, I just can't leave until we talk about your code status. If you go down, they are going to throw you on the floor. They're going to, and I explained all of it, like, this is what they're going to do to you. And he said, Penny, is this a good place to die? And I said, look out the window at the garden. Look at the bird feeder. Look at this place. It's beautiful. This is the best place to die. And he said, okay, bring me that piece of paper. I'll sign it. And so he signed it, and he became a DNR. And he lived for several more days. His son, who he was estranged from, came to see him at the care center. And I remember sitting at the cabin, and I was like looking at my phone to see, because I could get emails for the death list, and he wasn't on it. And I was like, I can't go back and see him. I just cannot go back and see him. And so I called in sick. I was like, I can't go in. So we stayed an extra day at the cabin, and I was sitting outside, and I was looking up, and I was seeing an eagle flying overhead, which we have a lot of them. But for me, it was just like this real peaceful moment, being at the cabin, thinking about him. And I just somehow knew that he was dead. And sure enough, he died. And my social worker told me that his son had come to see him, and he sat with him, and they had a beautiful conversation. And he told his son, I'm at peace, and I'm ready to go now. And then he just died, just like that, which doesn't happen very often. That just doesn't happen very often, when somebody announces that they're going to die and then they die. So anyway, that was one of those situations where I had to give a little bit of myself for him to trust me enough to where he would believe me when I said, you need to go to a care center, you need to be a DNR.
Yeah. Yeah. Wow. Oh gosh, you just like rendered me speechless there for the last 5 minutes. And I think how often those are the conversations that really, maybe lack of knowledge around what that means, DNR, for most people, because they just don't even know what that means as far as the last moments of their death and what could actually be taking place then. It's just like how much, trauma you've saved him and his family. And, most people just think it means I'm going to get extra time to live.
Mm, yeah.
And that is just not true. So
That's a fault of TV shows, right? Where they go and blow on them and they're like, oh, I'm better than I was before. And that's one of the things that we explain to our patients is, first of all, the survival rate is extremely low. I think it's like 15% chance that you'll even survive. And if you're a hospice patient, then that chance is even less. You're frail, you're dying already. If we're able to get you back, you're going to have broken ribs. It's going to be painful. And you are not going to not have cancer anymore or dementia or whatever else it was. You are still dying, but you're actually now in worse shape than you were before.
Yeah. Yeah. Well, let me just kind of move into this question because, this part of this conversation series is really talking to ceremony or ritual, whichever way you want to say that, and just how that is worked within, the death and dying field. And I'm just curious, and you can take this question any way you want, however it comes to you, but how do you see ceremony and ritual really playing a part of healing in individuals and families after a death or before?
Before, after, during, definitely. Cultural practices are really important. And it's one thing I love about hospice is that, we're a diverse group of people. We honor diversity. We honor all spiritual paths, religious or otherwise. We don't proselytize. Something that's really interesting about cultural practices, people often ask me about opening a window. Do you open a window when a person dies? Have you guys heard about this, opening the window when someone dies? Like in some cultures, you open the window to let the spirit out. And people ask me, how do you feel about that? Well, if the family says to me, hey, will you open that window? I'm going to do it for them. But I am not going to walk over there and open that window unless they ask me, because there are some cultures that don't practice opening the window, like they don't do that. And at the care center I worked at, we had a patient die and somebody went in and opened the window before the family came there. And when they arrived, they were so upset because the spirit had been let out of the window. Never mind that it could easily slip under the crack of the door, you know what I mean? But they were upset about it. And so I realized, this is something that's a unique cultural practice. And to go and open the window after a patient has died is the same as proselytizing. It's the same as bringing somebody a Bible and saying, hey, I can help you get to heaven, and we should not do that. But I've been able to experience some really great cultural practices. And the best thing to do when you're a hospice clinician is to definitely allow the family to lead that. You follow their lead on that, and to arrive at the house of a person who has died, and they open the door and you can see everybody sitting on the floor cross-legged and they're chanting, and there's a Buddhist monk there, and you quietly go in and you sit and you get to be present for it. And it's really, I definitely think it's healing for the family to be able to practice these things. And they don't always have to be, religious based or, some kind of a tradition in the family. It could be any little thing. It could even be like back to the date that the person died, right? Like that's why I feel like it's important that people get to have the date of death be the date of death, because some people feel like, Christmas was a really important holiday for us. And the fact that we got to be with her on Christmas and she died on Christmas is something that, we are really grateful for. And then the nurse pronounces the day after Christmas. And so it didn't happen. Not to beat a dead horse, no pun intended, but, it's just, it goes with whatever a family feels is spiritual, cultural, religious or just something that is just any little thing that they want to do around their person dying. It could be that they're painting that person's toenails. I mean, it could be anything. It doesn't have to be like this big elaborate thing. It could be, here's a great story. I'm going to tell you guys another story. So I had this patient who had a daughter, only child, single mom. Mom was dying. I walked into the room and the daughter's standing by the bed and she's got something in her fingers and she's putting it in her mom's mouth, and her mom is actively dying, unresponsive, and she's tucking this in her mouth. And I said, "What have you got there?" And she said, "Chocolate." I said, "Oh." And she said, "My mom told me that she wanted chocolate every day until she died. And so I'm giving her chocolate." So it wasn't religious, it wasn't cultural, it wasn't spiritual, but it was a ritual that was really healing for her to be able to do that for her mom. So dressing a patient, like I've helped somebody dress their mom in their favorite outfit, there are so many different little rituals that people do that can make them, can help them heal through this grieving, that this thing that they did for their person, even if it's just, some little thing, playing their favorite song on the radio or bathing them. Oh, here's another story. Okay, you guys, you don't know what you're in for here, because like I'm on a roll. So I had this 42-year-old patient woman, her daughters were in their 20s, and we had a really, really hard time getting her pain and her agitation managed. She had severe terminal agitation. Her parents had her in their home and they were adamant she needs to be here in the home. We don't want her to go to a care center. I said, "Okay, we can work with this. We can work with this." So we did continuous care. We had her on multiple infusions and it took forever to get her sedated. At one point, as I'm talking to the family about palliative sedation, and she's already got 2 Dilaudid infusions running, and she's got, I forget what else going, but we got all these meds going, and we hear her in the background, in the back room yelling, "I don't want to leave my girls," and it was clear that she was just really suffering. She had an existential crisis. She didn't want to leave her daughters. And there was just nothing else we could do for her except for sedating her. And so we sedated her. And when we finally got her sedated to where she was comfortable, we could move her without her wincing. She wasn't in pain anymore. Her daughters and I bathed her. And her sister was my age. And her sister said, and I had grown real close to the whole family, but especially the sister, she said, "I don't want to put her in a diaper. It's so demeaning to put her in a diaper. She's 42 years old. I just don't want to do that." And I said, "We don't have to put her in a diaper. We'll put her in panties. And if she soils herself, we'll change her panties. No problem." So they picked out these tiger stripe or leopard print, I think it was leopard print panties, and her favorite t-shirt. We bathed her, me and her 2 daughters, we bathed her, we washed her hair. They put her favorite lotion all over her, dressed her in her t-shirt, put her in this infinity scarf that had come in the mail, because there was this joke in the family that she would get high and she would go online and order things, and then she'd forget what she ordered and a package would come and she'd be like, "Oh, what did I order?" So on the day that we got her sedated, a package came in the mail and it was an infinity scarf, and they were just cracking up because they were like, "Look, she ordered this infinity scarf." So we had to put the infinity scarf on her, and it was so healing for those daughters. And I bumped into them months after the death of the patient. I ran into them in a restaurant one night and they came and sat with me, and it was, and they still talked about it, like how healing that was for them to be able to do that for her. So rituals are important.
Rituals are, and your stories are fantastic, despite the pain and the grief in them. And they're just so, yeah, thanks for answering that question that way, because I think that like often, there is this grandiosity to ceremony and ritual and, what are we performing and how are we doing? And it's like, well, no, it really is just a little bit of like chocolate that reminds you, or painting your toenails, or bathing somebody. And just, it's that real moment to moment. How do I get through this moment? And how do I, make it meaningful and give myself some grounding in this moment too? you're actually making me laugh when you talk about the infinity scarf, because a really dear friend of mine who I used to live with and we were roommates, and she passed away almost 2 years ago. And we actually had something we called wine and prime. And we would get on Amazon drinking wine. We'd be like, what did we order last night? Well, we were up wine and priming. We almost forgot. It's kind of a funny similar segue into that story, but
so you guys had asked me where I get my inspiration for some of the videos that I do. And sometimes it's through conversation. And so like just now talking about rituals, I'm thinking, oh, I could do a story about rituals and I can educate people about how they don't have to have a grandiose ritual at the end of life. You know, I remember one time somebody asked, I talked about how we help people achieve their end of life goals. And somebody said, what kind of end of life goals do people have? What can that be? You know, and I said, it could be anything. It could be they want to take a trip to Hawaii, or they just want to be at home. You know, it could be anything. So, you know, you like people sometimes they think so big picture, and you don't have to. It can be something little, you know. So I'm like, I need to take a note. I need to write a note right now about rituals, because
okay, write that note. I like that. We'll be watching this tomorrow. I'm sure. Yeah, that's something Amanda and I are so passionate about, this just allowing families to have a space and a container to feel what they're feeling. And you know, it doesn't have to be this immense thing. Sometimes it is pre-planned for the family, so the family knows how you want, you know, the space to be held and how you want to be grieved. And really all these spaces are for the grievers, right? So it's like just recognizing like, I'm going to help you set up this space while I'm here. Or we can help you do it after, you know, one passes, but it's really just to like feel all the feels that are involved in losing your loved one and all the emotions that come up around that. And I think you speak to that so graciously. It's just like, it is regret, it is forgiveness, it is, you know, it's the gamut of things. It's not just this like, oh, you know, it's perfect family dynamics and we're just so grateful for everything that happened. It's like, let's hold a space that can really be like, everything can be shared within it, but which is also challenging, but in a responsible way, you know. So it's just really setting the stage to create that space. Well, you are just somebody we could talk to forever. I can read the expression on my sister's face and my own as we're just like, we could just sit here and chat with you forever. But let me ask you, we have another question for you, and we're just kind of moving towards the end of the session here because it's almost at an hour, but we're really interested in, you know, what is inspiring you regarding the direction of your work or any projects that you're personally working on?
What is inspiring me? I'm just really inspired by people who are always reaching out and sharing their journey with me, and telling me that I made their journey better. And that really inspires me a lot. I want to help people, you know, I want to be helpful to people. And so that really is what keeps me going. And it's to the point now where I'm doing this so much that I'm actually going to cut back on my real job. My goal is to eventually go back to doing patient care part-time. When I worked as a case manager, I lived in Seattle and I had to be in Seattle traffic, and it was horrible. And I used to dream about moving to this cabin in this very rural area and driving around in the beautiful countryside and seeing patients. And so I'm ultimately moving towards that. But in the meantime, I just recently told my boss I have to cut back on my hours because I'm now to the point where I'm getting brand deals. I'm getting money from my TikToks and my Instagrams, but more importantly, I now live off the grid in a cabin on property that's completely paid for. We sold our house. We have no mortgage. I don't need the money as much, but I want the time. I want the time to enjoy my life, because life is short and we're all going to die. And I don't want to look back and go, damn, I wish I would have had more time to do stuff that I love to do. It was my dream to live up here, and now I do. And I spend a lot of my time working. And work for me doing TikToks is fun. So that's not work. So I'm really inspired by the people who tell me that I'm helping them. And that's what keeps me going and wanting to do this more. That I get some hate, people don't like hospice nurses. They think that we are murderers. But that's far and few between. I get much more, I don't want to say praise, that sounds weird, but affirmation that what I'm doing is helping people. Like, it's helping
Yeah.
people.
Yeah, absolutely. It is helping people, and just hearing where your level of passion and integrity falls within it. It's very clear. So you are an inspiration and in the way that you live in your purpose. And it's very clear this is your soul calling and this is your work in the world. And I think it's always very beautiful when you just really, cross paths with somebody who's doing their work so intentionally and so deeply and with so much care. So thanks for sharing this time with us. It's been such a pleasure. And we just want to know, where can anyone find you, Penny, who wants to find more about your Instagram or your TikTok or your website? Where would you lead people?
So I'm on TikTok and Instagram. My username is @Hospice Nurse Penny, all one word, Hospice Nurse Penny. I'm also on Facebook, Hospice Nurse Penny. Don't have a website yet. I have to tell you something funny, one more funny thing. So, you talked about finding my calling, right? My sister said to me, don't you wish TikTok would have been around when you were in your 20s? Like, you were meant for TikTok. And I'm like, I know, it's kind of a bummer that, here I am, I'll be 60 in September. Darn it. Why couldn't TikTok have been around 30 years ago? Well, probably because I was a total fuck up and I would not have been very inspirational back then. So it took a while for me to get to where I'm going. But anyway.
I don't know many 59-year-olds who are, not that age is the parameter, but are rocking TikTok the way you are. So
Thank you. Iconic.
To it. I was just going to say, you're absolutely an inspiration and an icon. We're so thankful for our time tonight. And yeah, like Jess said, we could just chat with you all night long.
Thank you. Thanks for having me.
Thank you so much. For our listeners, just a reminder, if you enjoyed today's conversation, please share it on your favorite social media platform. Go follow Penny and be sure to sign up for our newsletter at spiritvessel.com/newsletter so you can be one of the first to know when our new conversations are released. Thanks again for being here.
Thank you.